Welcome back. We all want to feel our best, and with all the weight loss products and drugs on the market, it can be confusing. What actually works? What is the safe way to do it? So we're going to talk all about it.
Yeah, I mean, it's an important topic, and we've got our 9 News expert, health expert, Dr. Payal Kohli, with us to break this down. I know we've talked a lot about this, but it feels like more and more people, at least more and more people personally that I know, have been taking these drugs, so it deserves more conversation. I guess first and foremost, do they work? Do they really help you lose the weight?
They are incredible. They're game changers. And in medicine, actually, it's really been a wake-up call for us because for decades, we have been talking about get off the couch, exercise more, and putting it on the patient who has clinical obesity to get that weight off. And now we finally have a medical solution that's not just effective, but it's safe. It's not just a weight loss drug, but it's turning out to be a diabetes drug, a heart disease drug, a kidney protection drug, and so much more.
Wow. Okay, so here's the thing, though, because it's become, like many weight loss drugs in the past, has become really trendy.
Oh, yes.
So how does someone know if they really need it and if they qualify? Because I don't want somebody taking it just because they want to lose 5 pounds before, to get into a dress for their wedding.
Neither do I. And I mean, that is irresponsible use of these drugs because we don't know if it's safe or effective to use them that way. So there are a few criteria. First, if you're a diabetic, type 2 diabetic, you qualify for this medication. If you're somebody who has a body mass index, which you can calculate by going online, it's your weight and your height calculator. If it's over 27 with a weight-related condition like high blood pressure or sleep apnea, you qualify. Or if it's over 30, you qualify. And then, of course, as I alluded to, heart disease patients, kidney patients, we're starting to use it in them as well. But right now it's simple. BMI is elevated with a weight-related condition, or you have diabetes, you can get this medicine. In fact, you should get this medicine.
Well, I also want to ask you about where you're sourcing and finding the medicine, because now it feels like it's on every corner, every med spa. You can get it anywhere. I can get it the same place I go get Botox. I can have them also give me these drugs. Is that safe?
Not at all. You can, but you should not. Now think about this medicine, ladies. It's an injection that you're putting inside your body, even different from a pill, actually. So when we take a pill, our liver kind of detoxes it before it gets into our bloodstream. With an injection, it's going straight into the bloodstream, basically. So you want to be really careful what you inject. The FDA has put out a warning against these compounded versions. And the way that it works is it slows down the emptying of your gut, makes you feel full faster. So it changes the way, not just how you feel after you eat, but also how your body metabolizes the food. So taking it irresponsibly or taking a dirty version of it can lead to poisonings, can lead to organ damage, all kinds of problems.
How will someone know if they have a compound version?
Yeah, so that's really important, the source of where you get it from. So Novo Nordisk makes Ozempic and Wegovy, and then Eli Lilly makes Mounjaro or Zepbound. Those are the only pure sources. During the pandemic, there was a shortage. So all these compounded pharmacies got on the bandwagon. They have budget. It's a money maker, right? And so now all of a sudden, we're handing it out on street corners at med spas. This is not the real version. In fact, some of them have salts in it like sodium semaglutide, which are not even studied or effective. So it's really important to talk to your doctor. Now both Eli Lilly and Novo is working on one to have a direct-to-consumer program where you can get a prescription, go online, and get the real stuff shipped to your house. So if you're somebody whose insurance doesn't cover it, but you really want it, your doctor thinks you should get it, get that prescription, send it to Eli Lilly direct, and you can actually get these medications.
That is good to know because this stuff is expensive. I know I have been prescribed Mounjaro by my doctor, so we want to have some real conversation about what it's like to take these medicines. We're going to be joined by another guest a little bit later in our kitchen table talks. I think it's important to be real about these things. So, Dr. Kohli, thank you as always. And we'll talk to you a little bit more